a study from a lab in Hong Kong has suggested that because Omicron is, right now only affecting the bronchi tissue and not so much the lung tissue, and that's actually one of the reasons why the infection isn't very severe, but it is more transmissible. Do you have any studies or in South Africa, given that the variant was first detected in South Africa and Botswana, to suggest anything of this nature? And is there any peer-reviewed data? Because I know that the WHO has already said there isn't much data which is available just yet on the severity of the infection.
So so two questions. So the first one regarding Omicron first detected in South Africa. So yes, it's true. It was detected in South Africa and Malawi. But when Europe, especially in the Netherlands, went back and looked at their PCR samples, it was already in Europe, in the Netherlands.
Sure.
A week before it was discovered or being recognized in South Africa and Malawi. So for now, it seems as if Omicron actually started in Europe. So that's the first one. The second one is, yes, it is predominantly a disease that attack the upper respiratory tract and not so much the lung itself. But I have seen a pneumonia, COVID pneumonia case yesterday.
Okay.
And so you should not think that you can't get pneumonia. You can. This specific patient, severely overweight, high blood pressure and diabetes patient. So you still have your patients that you need to monitor and make sure that they don't get severe disease. But the studies, what we are seeing, again, the majority of people has got mild disease. And I think I have already said that, so that, but it's important that people still go and get tested and go and see a healthcare worker.
So you are saying clearly do not dismiss this as a mild infection of the upper respiratory tract.
That's what we are seeing. We see a mild. So in the majority of cases, it's mild. But you will always. So this is the thing with a virus. You can never underestimate any viral infection. Okay. So if you are suspectable, let's say you're not, especially if you're not vaccinated, you're an older person with a lot of diseases and severely overweight, you might have a problem with Omicron. And therefore, we keep on saying, please get vaccinated. And people who can go for boosters should get their boosters. You should target your population. You should target the vulnerable people, the older people, and people with immune-compromised disease.
Yes.
To get a booster shot so that you can try to get them out of hospital. For now, what we have seen in South Africa, the boosters still protect you, not the boosters, the vaccines, because we haven't started with boosters yet. The vaccines still protect you against severe disease. As I've said, the majority of people in the ICU or high care are unvaccinated people.